Hello, my name is Dr. Shevchenko from Smiles by the Sea Family Dentistry in Hampton, New Hampshire. I do get asked a lot of questions about Invisalign, so I'm going to be answering some of those questions for you. So Invisalign is a kind of orthodontic treatment which is designed to move your teeth. It can correct many different, kinds of malocclusions, what we call it. So it's a type of orthodontic treatment. So Invisalign is a series of clear aligners which are designed to move your teeth to correct, for example, one patient might be trying to correct a crossbite, other patient might be trying to correct the gap in their teeth, other patient might be trying to correct any crowding in their teeth. It's a series of clear aligners that are designed specifically for your case, and a patient wears them for a designated length of time to correct the problem that they have. Invisalign usually, yes, it is usually faster than braces, much faster than braces. Invisalign is usually considered more comfortable than braces because with the Invisalign trays, patient is always wearing the trays and the movements are built in, are subtle movements that are always happening. Instead of with braces, patients who had Invisalign treatment before, or they might have heard from others who had treatment with braces that they used to tighten them. So because of the tightening, they would feel a sudden pressure on their teeth. So that made it a lot more uncomfortable versus with Invisalign, the way the trays are designed, there's always small movement that is happening. There's a slight little pressure that's happening. So it's not creating that discomfort feeling that usually comes with the braces. Also, because the trays are so sleek, they are very firm to your teeth. So you're not feeling all that discomfort of a wire, the metal in your mouth. So because of that, patients love doing orthodontic treatment with Invisalign. So the length of treatment time can vary for every patient because it's designed to move your own teeth. Every patient has a different problem that we're trying to solve. So based on that intensity of the problem, what we are trying to correct, the length can vary. But on average, the Invisalign typically averages anywhere from 4 months to 8 months of treatment time. So the process for the Invisalign treatment is very simple, very straightforward. The very first thing is when patient comes in, let's say they're coming in for a consultation, I will do the consultation with the patient, make sure they're qualified and this is the best treatment for them to go through. We do a very quick 3D scan. It's a series of pictures, very precise pictures that we take and we submit it to Invisalign. It creates almost like a 3D movie for it. And we take some photos as well. And patient, trays come back into the office. We bring the patient back in to give them the trays, put the little clear button that they go instead of the metal bracket. So there's no metal whatsoever with Invisalign. And patient comes in for the appointment. We give you your trays, let you know how many trays you have to wear, how many days after I'm going to see you back for our checkup. So we typically do a couple checkups in that time period to see how you're doing with the progress, any questions you might have. So, and after that, you come back in, we do the final check, remove all that you have on your teeth, do the scan for your retainer. So it's a very straightforward, simple process, does not involve any needles, no drills. So how many Invisalign trays you could need? That's another question that I get asked as well too. So it depends. It depends how long your treatment is going to be. So one person could have 15 trays to complete their treatment. Other person might need 60 trays to complete their treatment. So treatment length and the amount of trays varies on what we are trying to correct, what we are trying to achieve for you. So the trays length will be based on that. Yes, the patient does sleep with the Invisalign for the reason that we want that movement to be slow, subtle movement always happening. And also we don't want any backward movement as well too, because our goal is to get there, start the treatment, get it done as efficiently, as quickly as possible so you can enjoy your beautiful smile. There are some things which can disqualify a patient from getting the Invisalign treatment. One of them is that if the patient has a severe active decay, we want to make sure that that decay is out, your healthy teeth. Other thing is if you have an active periodontal disease, so you want to make sure your gums are very nice, healthy, and strong so they can hold making any movements to the teeth. If there's any infection in the mouth, we want to make sure your gums are healthy, your teeth are healthy, your foundation, your bone is healthy. Those are some of the disqualifying points that patient cannot go into Invisalign treatment right away. Invisalign can fix crossbite. There are certain types of crossbites which Invisalign may not be able to fix, but many of them can be fixed with Invisalign. Again, it's a question about when we see the patient, we evaluate the patient, do the exam, and determine if this is something that Invisalign can fix with it. Invisalign is not painful. Sometimes patients may feel somewhat discomfort, which usually subsides within the first week, and there's no pain whatsoever afterwards. So Invisalign can be covered by dental insurance, as it typically depends on what your benefit is, what your plan is. So based on everybody's plan could be different, what benefits you get from your insurance. So some insurances do have the benefit towards Invisalign, and the amount could vary anywhere from $500 to $2,000. So it depends what specific plan you have, what policy you have, there's what age limitations you have, but there are some insurances which do cover Invisalign. I hope I was able to answer most of your questions. If you have any questions, please don't hesitate to call us at 603-926-8827, and we will be happy to help you.